Hi, this is Dr. Robert Chao reporting virtually from EULAR 2022 for Room Now. And I wanted to discuss a topic today. I think a lot of us in rheumatology are sort of a question that we're posed with on a daily basis, which is, when can we stop a medicine? And I see this often where before I even talk about the new TNF inhibitor or the new biologic we're going to start and potentially the side effect profile, the first question I'm faced with is doc, when can I stop it? Do I have to be on this forever? And that can be a difficult conversation to have at times. And this is what this abstract OP0261 focused on. And they looked at a treat to target tapering strategy of TNF inhibitors in the treatment of psoriatic arthritis and axial spondyloarthritis patients. These patients were randomized, controlled, and this was a non-inferiority trial of patients who used TNF inhibitors for at least more than 6 months with stable low disease activity. These patients were then randomized to a treat to target tapering or no tapering strategy, and they were followed for 12 months. And just by the way, the tapering was 3 monthly steps of 66%, 50%, and of course, 0%. Overall, 122 patients were enrolled, and 69% of the tapering group remain in low disease activity, and 73% of the no tapering group remain in low disease activity. At 12 months, 72% of patients successfully tapered without flare, and 28% were even able to discontinue the TNF inhibitor. This study found that tapering was non-inferior to a no tapering strategy. However, this study did also find there was an increased use of other medicines, such as NSAIDs, conventional DMARDs, and even steroids in the tapering arm. So I think studies like this can help us better answer questions that we receive from patients in the future. We do know that medications like biologics, especially TNF inhibitors, pose an increased infection risk, patient burden, and of course, cost. I think we can use this strategy perhaps even as a blueprint for discussing tapering with patients who we think are at least in low disease activity for a period of time. And lastly, I do want to focus on, we discussed tapering and stopping a TNF inhibitor, which can be a big milestone for a lot of folks. But the question I would pose is at what cost? If we're tapering or stopping a medication, but then substituting that with daily NSAIDs, another DMARD, or God forbid, daily prednisone for prolonged periods of time, is that really a win? Or are we just substituting one with another evil, if you will? So I think these are all questions to be had. But thanks for tuning in. This is Dr. Robert Chao again reporting virtually from EULAR 2022 for Room Now. And please follow me on Twitter at Dr. RBC. Thanks.